So there are a lot of processes that need to be improved in hospitals, and healthcare solutions, IT solutions, can really help. And I know that physicians in general sometimes become cynical because the implementations have been very painful of electronic health records. And being a clinician myself, I understand that. That's one of the reasons that I've gone into informatics to study it, and why I'm now working for a vendor organization, because I think the products and the solutions themselves need to have that clinical spin on them, so that we can make sure that they meet the provider's needs. And all of the work that the physicians are doing right now, entering information in electronic health records, we need to be able to leverage and pull that information back out and provide it back to clinicians so they can make better decisions about patient care. So the software solutions that we're working on, and that other healthcare IT vendors are working on as well, are really allowing those physicians to be able to get access to that data that are stuck inside the electronic health records right now. And when we get access to that data and provide it back to the end users, it allows us to be able to make a lot of operational changes that make improvements for better patient care. Right now, providers struggle. They don't even understand the cost of a lot of the things that they offer. So providers don't have the information that they need to make good decisions, and they can't provide that information back to their patients. And so, for instance, I've worked with surgeons before who don't understand the cost variations between the implants that they're using. They don't understand the cost between the catheters that they're using, or how their cost preferences and their product preferences impact the overall patient cost and the patient bill. And so providing the cost information back to the providers so they can share that information back with the patients and then use it for better shared decision making will allow operational efficiency, because it gives that patient more information that they need to make decisions, as well as the provider. It's one of the focuses here at HFMA this year, and I know there's been things in the news that have shown that we're not meeting the mandates to be able to get that information out. And one of the reasons we can't get that information out is because hospitals don't know what the costs are of each one of the things. We've been measuring our charges, and charges are not related to costs necessarily. So we need to be able to map the actual charges back to the care that was provided. For instance, if you're looking at nursing cost is all incorporated. So the 70% of cost that takes of your cost in a hospital of labor is all incorporated into your daily room charge. And that daily room charge, then it's hard to break. We need to be able to break that down and fully understand the costs that go into taking care of the patient, so then we can add them back up and give a patient a true message of cost. We also need to be able to understand cost at that lower level, that very granular level, in order to be able to understand how to more efficiently run our organizations and provide that information back to providers.